From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Friday, December 4th, 2020. I'm Brian Schrader. North Carolina hit a record-high daily case count on Thursday, 5,637 new cases reported. That shattered the previous record by more than 1,100 cases. One of the first questions directed to State Health and Human Services Secretary Dr. Mandy Cohen during her Thursday briefing: why not impose more restrictions?
We knew as we're heading into the season when things are colder and thus people go inside more. We head into the holidays where people want to gather more. We knew that there is just going to be more risk of spread. And unfortunately, we are seeing that play out in our numbers. We know, though, what to do. We know what prevents this, right? We know the 3 W's work. We know wearing a mask. We know keeping your distance, limiting your interactions with other households, washing your hands. All of that works. So if we were all to follow the things that are currently in place right now, I don't think we needed to do more. But we know that that is hard. We know that we are asking a lot of folks, and it may be possible that we need to go backwards. The governor said earlier this week, everything is on the table. We are looking at other options. I certainly look at a lot of other states around the country. What are the actions that they are taking? How has that impacted their numbers? And I look around the world. What are other countries doing? How have restrictions improved or not improved their numbers? And what does that mean for us here in North Carolina?
Thursday marked 9 months of COVID-19 in North Carolina. Our first case was reported March 3rd. While stressing the importance of adhering to the 3 W's amid the climb in cases, North Carolina health officials are focusing on preparing the public for a vaccine rollout. It's going to come in 4 phases, starting with healthcare workers who have direct contact with COVID patients. Dr. Cohen explains how that's going to happen and who's going to get priority within the health system.
We will do a distribution to our hospitals based on their hospital size. And the way the Pfizer vaccine is packaged, you essentially have to ship 1,000, it's actually 975 in a unit. So that's a lot we have to package together. So we can't actually break it down into smaller units and get it to even more hospitals, which is why when we get 85,000 doses, it can only go to so many hospitals. It can't even get to the more than 100 hospitals we have here in our state because, again, they package it 1,000 together. And we certainly don't want to be wasting any vaccine in our early days here. We want to be really efficient with how we get our vaccine out. So it will be to a limited number of hospitals. It'll be based on hospital size, as well as figuring out the population. So that is how the distribution will go. Again, to a limited number of hospitals, generally are larger hospitals. The hospitals themselves will then prioritize vaccination for their staff that work directly with COVID patients. So we're asking them to really be thoughtful about prioritizing to people who work on COVID units, clean COVID units, maybe part of the environmental staff, folks who are in the emergency room, who are taking care of patients where they don't know if they have COVID or not, but have a high risk of exposure.
Looking ahead to next week, all eyes focused on Thursday, December 10th. That's when the FDA meets to consider Pfizer's emergency use authorization. This has been your Coronavirus North Carolina News Brief for Friday, December 4th, 2020. Let us know what you think of the podcast. Leave a rating or review wherever you listen, and be sure to subscribe so you don't miss a new episode. I'm Brian Schrader. Have a good weekend. Thanks for listening.